Good morning, ma'am and sir. Good morning, pre-service teachers. I am Chiron Love O. Perez. So today, I am going to enumerate and describe the educational approaches in teaching learners with emotional and behavioral disorders. When we say behavioral disorders, or also known as conduct disorders, this is one of the most common forms of disability among children and young adults and is the most frequently cited reason for referral to mental health services. The appearance of behavioral disorders is increasing dramatically in our K-12 classrooms. As a result, their presence severely constrains the ability of the school systems to educate students effectively. The prevalence of behavioral problems among children and young adults is substantial. Behavior disorders have also been referred to in a variety of different terminologies, including but not limited to emotional and behavior disorders, emotional conflict, serious emotional disturbance. Behavioral disorders became apparent when the student displays a repetitive and persistent pattern of behavior that result in the significant disruption of other students. Such disturbances may cause significant impairments in academic, social, and occupational functioning. Among characteristics of the behavioral disorder among children and adolescents are a display of bullying, threatening, or intimidating behavior, being physically abusive of others, deliberate destruction of others' property, showing little empathy and concern for the feelings, wishes, and well-being of others. They may readily inform on their companions and tend to blame others for their own misdeeds, does not follow or appear to care about classroom rules, poor concentration, resistance to change and transitions in routines, often speaks out with irrelevant information or without regard to turn-taking rules, demonstrates aggressive behavior, regularly absent from school, consistently blame others for their dishonesty, low self-esteem, difficulty working in groups, demonstrates self-injurious behavior, cannot apply social rules related to others' personal space and belongings, and also the often manipulative of situations. For the general strategies, multidisciplinary educational teams, including parents, must design programs to meet the individual behavioral and academic needs of identified these students. Most students can benefit from supportive treatments provided in general education programs. For others, at least temporary placements in special education classrooms, schools, or institutional programs may be appropriate. Special education programs usually attempt to provide a structured environment where students experience a high degree of success, rules and routines are predictable, and students are consistently rewarded for appropriate behavior. Behavior management techniques such as positive reinforcement and having the assessment and systematic teaching of social skills through modeling, discussion, and rehearsal are frequently used to help students increase control over their behavior and improve their relations with others. In addition, supportive therapies involving music, art, and relaxation techniques, as well as effective education, individual and group counseling are sometimes employed to improve self-understanding, self-esteem, and self-control. The following are strategies that may be effective with students with ABD. You may ask previous teachers about interactive techniques that have been effective with the student in the past. Expose students with behavioral disorders to other students who demonstrate the appropriate behaviors. For the teacher presentation, you need to anticipate classroom situations where the student's emotional state will be vulnerable and be prepared to apply the appropriate mitigative strategies. for using routine is essential to managing children with problem behaviors. Routines allow students to know what is next and minimize surprises and unpredictability. By using examples, encourage students to learn signs so that they can emulate adult behaviors. Check on the student's basic capacity to communicate and adjust your communications efforts accordingly. You may use a wide variety of instructional equipment which can be displayed for the students to look at and handle. Instructions should be simple and very structured. Group participation in activities is highly desirable because it makes social contacts possible. Monitor the student carefully to ensure that students without disabilities do not dominate the activity or distract in a way that the successful performance of the student with a behavioral disorder. Teachers should reward students for good behavior and withhold reinforcement for inappropriate behavior. Special efforts should be made to encourage and easily facilitate students with behavioral disorders to interact. Show confidence with a student's ability and set goals that realistically can be achieved. Plan for successful participation in the activities by the students. Success is extremely important to them. The environment must be structured but sensitive to the needs of these youth with behavioral disorders. Expose students with behavioral disorders to other students who demonstrate appropriate behaviors. Direct instruction or target behaviors is often required to help students master them. Keep an organized classroom learning environment. As an educator, you serve as a model for the students with behavioral disabilities. Your action, therefore, must be consistent, mature, and controlled. Behavioral outbursts and/or angry shouting at students inhibit rather than enhance classroom. Let your students know the expectations you have, the objectives that have been established for the activity, and the help you will give them in achieving objectives. Do not expect students with behavioral disorders to have immediate success. Work for improvement on an overall basis. Be fair and consistent, but temper your consistency with flexibility. You should refer the students to visual aids and reading materials that may be used to learn more about the techniques of skill performance. For the laboratory, use the appropriate general strategies given above. Consider alternate activities or exercises that can be utilized with less difficulty for the student but has the same or similar learning objectives. If unstructured activities must occur, you must clearly distinguish them from structured activity in terms of time, place, and expectations. Be sensitive in making team pairings for activities so that the student with an emotional disorder is supported. Use a wide variety of instructional equipment which can be displayed for the students to look at and handle. For the group interaction and discussion, acknowledge the contribution of the student with an emotional disorder. Call for responses and participation commensurate with the student's socialization skills. As the student's comfort level, you have to encourage the student to be a group spokesperson. Along with the student, devise a contingency plan which inappropriate forms of response are replaced by appropriate ones. Gradually increase the challenges in the students' participation in group exercises while providing increased positive reinforcement. Then you need to help the student to feel as they have something worthwhile to contribute to that discussion. For the reading, it is necessary to target specific pro-social behaviors for appropriate instruction and assessment to occur, such as taking turns, working with partner, following directions. Instructional strategies involving self-control, self-reinforcement, self-monitoring, self-management, problem-solving, cognitive behavior modification, and metacognitive skills. This should be focused on teaching students reading skills. For the research, review and discuss with the student the steps involved in a research activity. Think about which steps may be difficult for the specific functional limitations of the student and jointly devise accommodations for that student. Use appropriate laboratory and field strategies. Depending on the site of the research, check the previous two sections. Show clear examples of what the students should expect as an outcome of their research. For the field experiences, use inappropriate general strategies. You need to consider alternative activities or exercises that can be utilized with less difficulty for the student but has the same or similar learning objectives. In field activities, acknowledge the contributions and assistance of the student with an emotional disorder. You need to help student to feel as he or she has something worthwhile to contribute to the field trip, and you need to use a buddy system. Gradually increase the challenges in the student's participation in field so that it is highly desirable because it enhances social contacts. Make the student with a behavioral disorder become one of the field trip leader of an activity, which can often reduce their disorder. To test our student or testing, we need to be sensitive to the student's reactions to the various aspects of assessment. Make special arrangements for the student with an emotional disorder according to what their special needs and what they do not compromise the integrity of the testing situation. You need to stay on top of student progress through informal assessment. Don't wait until it's too late to discover that there is a problem. You need to provide private room or smaller group setting alternative test site with proctor present, alternatively screens to block out distractions. So that's all about the educational approaches in teaching learning with emotional and behavioral disorders. Thank you for listening. Have a good day, everyone.